Good afternoon and welcome to the third floor conference room of Waco City Hall. I'm Larry Holsey, Director of Municipal Information and Communications for the City of Waco. Joining me in this room, with all social distancing, is Julia Olvera from the City Secretary's office, Kelly Crane from the Health District, Mark Randolph is our television producer, and we're here all observing social distancing, but we have our masks on as well. Today we're going to continue with the same process that we have before. We have five distinguished gentlemen in specialty fields and things. We'll have them answering questions, but before we do that, we always want to let you know the fact that we're doing everything we can to communicate this to everyone that's out there. We're in our studio downstairs. We have an American Sign Language interpreter providing that service, and also we are recording a full audio track in Spanish for this press conference. Everything that'll be said will be aired this afternoon at 4:30 with the press conference video, but all in Spanish. And always so gracious to be a part of our press conference opening is our City Council member for District 2, Hector Sabito, to invite our Spanish-speaking audience to watch that and view that this afternoon. Hector, thank you for being with us again.
Larry, as always, thank you so much for the invitation. It's always great to be here. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esta conferencia de prensa. Esta grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Larry, thank you once again. Have a great afternoon.
Thank you, you too. Thank you so much for being part of that. For joining us today for actually our 31st weekly press conference since this pandemic began. First of all is our mayor, Waco Mayor Kyle Deaver, McLennan County Judge Scott Felton, Dr. Jackson Griggs from the Family Health Center, Dr. Mark Lawson from the Baylor Scott & White Medical Center, and Dr. Brian Becker, Chief Medical Officer for Ascension Providence. Always, gentlemen, appreciate you all coming and providing the information that the community has talked about and what's going on. We'll follow the same protocol and everything. We'll let each of you make an opening statement, and then following that, I'll read the questions that we've gathered throughout the week, and then we'll open it up. We have two media representatives that will ask questions, and then we'll let each of you have a closing comment too. So let's get started right away. Let's start off with opening comments. We'll go with Dr. Jackson Griggs first, followed by Dr. Becker, then Dr. Lawson, then Judge Felton, and Mayor Deaver. So Dr. Griggs, take it away.
Thank you, Larry, for the welcome, and thank you for having me back, Judge and Mayor. I'll begin by sharing our global, state, and local numbers. Worldwide, 36 million cases, and for the past 3 weeks, global weekly incidence of new cases has been just over 2 million new cases of the novel coronavirus each week. In the United States, we've seen 7.5 million cases and over 211,000 deaths to date. COVID-19 continues to be the number 3 cause of death in the United States following heart disease and cancer. Texas has seen 773,000 cases and 16,111 fatalities to date. Now, McLennan County numbers as of this afternoon, our total number of confirmed cases is 8,716 to date. 486 of those are currently active. As of this afternoon, the Public Health District has received notification of 74 new cases of coronavirus. 48 people are hospitalized at this point, and 6 of those hospitalized individuals are needing ventilator support. There have been an additional 3 deaths from COVID-19 in our community, and that brings our total count of fatalities due to this disease to 122. So our sympathies go out to those whose lives have been lost due to this disease. There have been, to date, 69,000 total tests performed in McLennan County, 95% of those have been performed on McLennan County residents. And within elder care facilities, there are currently 8 outbreaks. Remember, an outbreak means at least one active case in that facility, and there are 21 active cases in those 8 facilities. At the county jail, there are currently only 2 active cases. There are 8 independent school districts that are reporting cases on campus. Within those 8 ISDs, there are 60 active cases. Among those 60 cases, 44 are students and 16 are staff. Now I'm going to shift to some prepared slides that just track these numbers graphically so that we can see how we're progressing and where our numbers fall in terms of the different strata or levels that we've benchmarked in the past. So I'll share my screen now. And here you see in the United States, new cases per day per 100,000. As I've shared before, we use this per 100,000 in order to be able to compare large populations and small populations on the same graph. It's a way to look proportionally at the number of new cases. Here you'll see in orange, Texas cases have exceeded national cases for the majority of the time period from June 1st to current. You'll see on the x-axis, on the across the bottom, the horizontal axis, you'll see that I have limited the dates from June to October here, so you just can see a little bit more clearly. But you'll see during this time period, Texas numbers new cases have been higher than the national numbers. Recently, there's been a little bit of convergence, though, in the last week or so. I'll add the green line, which represents McLennan County. And what it doesn't show is that long period of time where we were really proud of the fact that we were doing so much better than state and our nation. But then mid-June, as we're now all well aware, we saw a massive spike in cases, and our new cases per 100,000 in population has exceeded both the state and the nation consistently since June. And we're still about 21 new cases per day per 100,000 on rolling average. Now I'm going to add in those layers. These are the thresholds that Harvard's Global Health Institute has provided, which gives us some benchmarks of what to expect or what our risk levels are. And if you'll remember, this bottom strata, this bottom level is community spread. That's 1 case to 10 new cases per day per 100,000. Accelerated spread is 10 to 25, and then above 25 is that tipping point where we see exponential spread of the virus. What you see here is that both United States and Texas is just above that community spread threshold into accelerated spread, and then you see McLennan County recently was in just had crossed over that tipping point and now has come under that. There's nothing really magical about that threshold. In other words, there's not any perfect science that says you hit that threshold and things are going to be, very out of control or exponentially spreading. It's a benchmark taken from big populations to kind of evaluate where that highest level of risk is. And so I would just highlight that we are still teetering on a very kind of dangerous threshold right now for our community, and we can in no way begin to take it easy or feel like we have brought cases down under control at this point. Our test positivity rate, you'll see here the orange line is Texas at 7.3. This is the rolling average positivity rate. And then just above that, our McLennan County positivity rate, 7.9%. And you see that has come down since the end of August. And again, two different thresholds. Also, these are Global Health Institute numbers, but these are numbers that I've seen kind of reverberating throughout the epidemiologic medical literature, that less than 10 positivity rate is that threshold for mitigation. We can actually begin to mitigate the spread if we're doing enough tests to keep the positivity rate less than 10%. And we're there right now. I mean, we with the public testing we've been doing layered on top of the testing that we're doing in primary care and in the hospitals, we have achieved that level of positivity rate that says, okay, we stand a chance to begin to mitigate the spread of this virus. But we still have a long way to go to get to that threshold of suppression, which is 3% positivity rate. And while right now that feels aspirational, as tests begin to get cheaper, as we're able to test more and more people who are minimally symptomatic or asymptomatic, we will get there to that suppression level positivity rate. Our effective reproduction rate, that's the RT. Remember, this is a measure of how many people one infected person infects. And for Texas, that number is 1.06 right now, so just above that threshold of 1. And for McLennan County, it's just underneath that threshold of 1. We'd like to see it much lower. And again, this I've said before, this is kind of our report card on how we're doing health behavior wise, because we're in control of that RT number. When we're doing everything that we know to do in order to prevent spread, and we're doing it well, we'll see that RT number go down. I showed these slides last time, and I'm only briefly going to hit on them because I think they should have a tiny bit more data. This is the average number of influenza-like and COVID-like illness on a day-to-day basis over the years of 2017 to 2019 with temporal benchmarks, the time of these different events pointed to here on the graphic that I'm sharing. Again, this is between ages 4 and 18 years old. And then this is this year. So again, influenza-like and COVID-like illness at the Family Health Center. What we see is up until April, the cases followed very almost exactly the historical trend. And then in April, we all began to exercise shelter in place, and we saw influenza-like and COVID-like illness decrease dramatically. And then June, in the ages 4 to 18, we saw influenza-like, COVID-like illness jump up with new incidents of disease. We saw it come down after masking orders, and then with school starting, we've seen more and more cases. And this, as I mentioned before, may be a lead indicator of what to see in the community as COVID spreads in younger populations. We do run the risk of seeing spillover in older populations. Let me stop sharing here, and that completes my report. Thank you.
Okay, thank you, Dr. Griggs. Dr. Brian Becker for Ascension Providence. Dr. Becker?
Hey, Larry, thank you very much. I want to again thank the mayor and judge and the team for inviting me back again this afternoon to participate. For Ascension Providence, I can tell you that for the past week, we've been pretty steady. We've had on average 30 COVID admissions in our hospital for the past 7 to 10 days, 10 to 12 or so in our ICU. And that's not been tremendously different from where we've been for several weeks now. So it would be nice to see declining numbers in our hospitalized patients. We may be seeing a bit of a shift from hospitalized McLennan County patients to patients who are presenting from some of our adjacent counties as well. So while we may see a decline in positivity rate in our county, there are some additional upticks in counties around us that may be impacting what we actually see in our hospitals. We have importantly started to do flu screening in the last 7 to 10 days. So every inpatient that's admitted is screened. Have they received the flu vaccine? Would they like to get a vaccine, and encouraging that vaccination? So that is something that over the past week we have begun to enforce across the hospital for all admissions, and would encourage folks across our community to get their flu vaccine. Thank you, Larry.
Thank you, Dr. Becker. Dr. Mark Lawson from Baylor Scott & White. Dr. Lawson.
Good afternoon. Thank you for having me as well. Always a pleasure and great to work with you and the rest of our community on tackling this great obstacle. So similar to Providence at Baylor Scott & White, Hillcrest, and Waco, we're seeing similar volumes. We haven't really seen a big surge, but we're still seeing patients trickling in. We've had some wonderful success stories and people who recover and get better and go home. But tragically, we've also seen some patients in our community, loved ones, and these are friends and family members who have succumbed to the illness. And it feels tragic and it feels like a big loss. We continue to struggle with this disease. We do have therapies, but to date, they are not perfect, and they are largely successful, but it's still a challenge. So we'll kind of talk through some of the questions throughout the rest of the program, but wanted to kind of share some of that with you. And again, a push for people to donate blood, particularly if you've had COVID-19 and you've recovered. We would encourage you to donate plasma. That therapy is one that's been largely successful in helping patients recover and overcome this disease. So if you are able to donate blood, we strongly encourage you to do so. And we're trying to avoid a flu pandemic this year. And so, we also are screening for flu at Hillcrest and encouraging our patients to get a flu vaccine. So if you have not yet gotten yours, please do so. We are already seeing flu cases in the community. Thank you.
Thank you, Dr. Lawson. McLennan County Judge Scott Felton. Judge? Judge Felton. Not here.
Okay.
There you go.
All right. Good afternoon. I wanted to go over a few things that's relevant to our county right now, primarily pertaining to the restrictions that we're under and what causes that and what we need to do to get out of it. But first of all, let me explain that sometime back, the governor created a new delta to look at to determine whether occupancy rates in restaurants and businesses need to pull back or they could operate at a higher level. And as you may recall, we moved from the last time from 50 to 75% because numbers were looking good. But the criteria to determine whether we could be in that 75% stage or not has to do with the amount of hospitalized folks that have the coronavirus. And so the level is 15%. So what that would mean is if you have a certain number of people with the coronavirus, you would divide the total amount of people in the hospital into that number to determine what percentage you're at. Unfortunately, we went over that 15%, and the governor had sent us a notice that we needed to roll back those requirements to 50%, and that went out across the county. That area that is calculated for that is what's called the trauma service area, which is a group of 5 counties, which are McLennan, Bosque, Hill, Limestone, and Falls County. Primarily because they have folks that are sick to a greater extent, then they're going to come in to where the closest hospitals are, and those would be in McLennan County, of course. And so those are calculated in the numbers. we were out of that for 6 days. We were actually below 15% for 6 days, but last Saturday we went back up to 15.41, which kept us from being able to change those restrictions to a higher occupancy level. So we're monitoring those. I think so since Saturday, so Sunday, Monday, Tuesday, and Wednesday, we've been below the 15%. So there's a big effort taking place right now pertaining to testing, and it'll be what's called surge testing, where the state has provided us with about 40,000 tests that we'll be able to utilize to help try to identify folks early on, for one thing, if they're sick, where they can get to their general practitioner or medical provider, or people that are do not have symptoms, asymptomatic people that do not know they're carriers, and they would know it after the test and be able to stay away and protect their friends and family by knowing this. So it's knowledge that's going to help us get out of this. And so I want to, this effort's led primarily by our emergency operations side, but supported tremendously by the Assistant City Manager, Deidre Emerson, and other folks. Ryan Holds in that area as well, working on this. It's going to take a lot of coordination. And also, I want to thank the venues where we'll have these different testing spots around the county too. And I urge you to consider getting tested. And if you're part of a company or run a company, to give opportunity for your employees to get testing, just like you would for getting flu shots. In other words, support them to get those shots as well. And so, we can call October a personal and public health month for McLennan County, that we really focus on these two things. So look forward to answering any questions that might come up later on. Thank you.
Thank you, Judge Felton. Welcome, Mayor Kyle Deaver. Mayor Deaver.
Thank you, Larry. Good afternoon. Thanks to all of you for joining us again today. I'll go ahead and get into a few graphics that I'll move quickly through. This is our this graph shows our cumulative cases since June 1st. Our new cases continue to rise at a steady rate. We passed 8,700 cases today. We've been averaging between 50 and 60 new cases per day for the last 4 weeks. This is much better than we were doing at our peak when we were at 150 new cases per day in July, but far worse than the very low number of new cases per day prior to June. Baylor continues to do very well managing the spread of the coronavirus on its campus. They've now been averaging less than 10 new cases per day for the last 3 weeks. This very flat line would indicate that there was no significant spread as a result of the football game against Kansas, which is very good news. Our hospitalizations have risen over the last couple of weeks, and even more concerning is that the number of patients requiring ventilators has risen. So while we've had about the same number of cases each day for the last 4 weeks, it appears that a significant number of those who are contracting the disease are having worse outcomes. And then this week we had 11 more deaths from COVID-19. That's 11 more of our friends and neighbors from McLennan County. This is up from 10 fatalities the week before. And now we have lost 122 people here in McLennan County from the coronavirus. Which brings me to say it appears likely that our hospitals can probably handle the level of new cases per day that we are currently experiencing, as long as we don't have a big increase in cases per day or a big increase in flu over the coming weeks. But the fact that they can treat those patients does not eliminate the fact that we're going to have way too many people become seriously ill, and far too many of those will die unless we're able to more aggressively slow the spread of the coronavirus in our community. And that's exactly what we have the opportunity to do with the abundant, free surge testing that Judge Felton just mentioned. That testing began today and will run over the next several weeks. If you want to make a difference and help save lives in our community, go to covidwaco.com and register to get tested. This will allow you to know whether you have the coronavirus, even if you don't have symptoms. Why is this important? Because if you're infected and you don't know it, you are not going to self-isolate. Then you are likely to spread it to your family, your friends, coworkers, and people you don't know in public. Many of these people are likely to get symptoms, and some may become seriously ill or die. The fact that you can spread the disease before you have symptoms, and even if you never have symptoms, is the thing that makes this virus so hard to contain. But as Judge Felton said, knowledge is power in this situation, and this testing gives us the knowledge that we need. It gives us the opportunity to have a tremendous impact on slowing the spread of the disease. But it will only work if large numbers of us go and get tested. So please, for the good of our community, for your family, for your friends, go to covidwaco.com and register to get tested as soon as you can. Larry, I'll turn it over to you now for questions.
Okay, thank you all very much. All right, let's get going. The first question I have, what are local hospitals doing to treat patients who arrive at your facilities, and what kind of drugs are available that you're administering?
Dr. Lawson, would you speak to that, please?
Yeah, gladly. So there's several therapies that are available, and they're used based upon a patient's symptoms as well as how sick they are. So if somebody just has mild symptoms, they're not requiring oxygen, Tylenol, whether that is administered at home or in the hospital, seems to be very helpful. One of the things that we really want to avoid and not give are what's called anti-inflammatories or non-steroidal anti-inflammatories like ibuprofen or Advil. Those medications tend to allow the virus to replicate and stay in the person for a longer period of time, potentially making them sicker. So again, Tylenol is a first-line therapy, and the avoidance of NSAIDs or ibuprofen. The next line of therapy would be oxygen. So if a patient is short of breath and their oxygen levels are low, we would administer oxygen to help provide some relief and to provide essential oxygen levels to get into the tissues. Other therapies that are available for patients who are a bit more sick are steroids. So using steroids such as Decadron or dexamethasone has been shown to save lives and decrease mortality rates. There's a large study that was done in Europe several months ago. This was back in the early part of the summer that demonstrated a clear survival benefit with this medication. And typically that's a 10-day course, and that was shown to have benefit in patients who were requiring oxygen. So again, for somebody who is just a little sick, they're at home, they're managing their symptoms, not requiring hospitalization, they do not need Decadron. Another medication that we're using in the hospital or a treatment is the transfusion of convalescent plasma. So let me rewind just a little bit and kind of talk about the illness and how plasma could help someone. So as you are exposed to any infection, but in this case, COVID-19, as you're exposed to it, your body begins to fight it off using various parts of your immune system. About 10 to 14 days into the illness, your body begins to recognize parts of the virus that are unique. And so it makes these proteins called antibodies, which will bind on to a part of the virus, partially immobilizing it. But what it also does is then sends up signals to your immune system saying, hey, come over here, there's a problem right here, come attack it. And so then it facilitates your immune cells to then grab onto it and dispose of the virus. The problem is many patients are very sick long before their body's making adequate levels of antibodies. So they do have an immune system, they are fighting it, but they're not fighting it full force with all the weaponry that they will one day have. And the problem becomes as patients are very, very sick and they're partially disadvantaged, we have a therapy. And that is borrowing or taking from someone who's been exposed to COVID, who's recovered, and has now donated those proteins to a blood bank. So then we can reach out to that blood bank, find a perfect match for that patient, and then give them that donated plasma, which again has those proteins. So that's called convalescent plasma because the patients who donated it have convalesced or they've recovered and have sufficient antibodies to donate. In my experience, donating or or giving patients that donated blood seems to be the most effective and dramatic beneficial therapy that we have. Not every patient who gets sick needs it. And if we had more donations, then we could probably give it out to more people. But patients who are requiring hospitalization and who are requiring oxygen seem to really benefit most from that therapy. One additional therapy we have is another drug called Rem Desevere. This was in the news throughout the summer because this was previously an investigational drug, possibly used for HIV, but was then being used on an experimental basis and has since been opened up for more broad use in COVID-19. And what it does is it allows or prevents the virus from replicating and spreading throughout the body. And unfortunately, that drug is on limited availability. We don't have a limitless supply of the medication, but we are using that in our sicker patients. That drug has some limited benefit. The studies that have been conducted with this drug don't show that it improved mortality. So it didn't save more lives, but what it did do was shorten patients' illness and shorten hospital days and shorten the amount of time that a ventilator was required in those patients. So that medication is also available. Those are the main therapies we have available in Waco and that have a lot of evidence behind them to show benefit.
Okay, we've talked about the 40,000 tests coming into McLennan County. They're being given daily throughout October. I've also heard that they are the nasal self-test type. Can somebody tell us how these differ from the other nasal tests that has a bad reputation, and are they as effective?
Dr. Griggs, would you answer that, please?
Yeah, I'm happy to. And there haven't been many times during the pandemic where I've had a sort of a joyful, jolly enthusiasm, but I have some right now, and it's because of this surge testing, this capacity for any of us to go in and get tested at free sites. This morning, first thing, I went in and got my test at the convention center, and it was easy. Folks were super friendly, very professional. I felt safe through the whole process. I didn't feel like I was going to get exposed. And so I heartily encourage everyone to go and get this test. Let me answer the question. At the testing site, individuals, there are testing staff who will offer a kit, and that kit allows you to swab you do it yourself. It's a self-administered test, but it will allow you to swab the inside of your nose. You enter into the nose about a centimeter, about half an inch, and you use a swab, make 3 good circles, slow circles, firmly pressing the inside of the nose, and then you use the same swab on the other side, and you go through the same activity. And then you put the swab into a little specimen tube, and you break the plastic swab stick, and then you screw closed the little plastic vial, and you put it in a baggie, and you drop it in a bin. There are staff there who coach you through the whole thing, so you don't have to watch a YouTube video or read complicated instructions in order to perform this self-administered test, because there are healthcare workers right there who are coaching you through the whole process. And I was in and out of the convention center in 20 minutes, and I was stopping to ask a lot of questions. So as long as there's not extensive traffic, it's not going to take a major part of your day to get a test. In answer to the question about the test characteristics when you're not doing a full nasopharyngeal swab, now that's the swab that you get in the doctor's office it's fairly deep, and it feels a little bit invasive and uncomfortable. This swab is one that is much simpler. And there have been a number of small studies that in symptomatic individuals and individuals who have been proven positive, following up with the self-administered test, it looked like that the self-administered test had very good, in fact, comparable test characteristics when observed. So when it's not observed and there's no one there to coach on how to collect the specimen, the characteristics of the test fall off. But if there's someone there to coach individuals who are self-administering the test, it seems that multiple studies have shown that the test characteristics are on par with the nasopharyngeal test. So you shouldn't go in thinking that I'm getting an inferior test, or this test that I'm getting is sort of second tier, second rate. It should give you good results. If it's positive, well, let me actually go ahead and share that what the plan is, as I understand it. Positive results, the health district will do investigations until they reach capacity. If we have so many positive results that they can't make the initial contact, then they'll use the state facility. State has a contract with contact tracers, and so you could get a call from either our local health district, or once they reach capacity, it could be the state vendor who would be making the call. But it is so imperative that if you are positive, to be absolutely sure to follow isolation instructions and not spread this virus through the community. Similarly, we're going to be able to quarantine a lot of our exposed community. And so when you get the call that you've been in close contact with someone who tested positive, it is vital that quarantine, those quarantine instructions are followed. There is a temptation to break quarantine, but remember that you could be costing others years of their life. You could be spreading a disease that is fatal, particularly among vulnerable people in the community. So it is so critical that you not break quarantine instructions, even if you go get a test and that test is negative. That does not suggest that you can break quarantine. A negative test is not an endorsement that you can return to work or you can return to university or school, that you can break quarantine. It's important that you follow the full 14 days of quarantine, even if you have a negative test. Okay, I'll stop here. Get a little carried away.
Well, you actually, I think, have answered the next question, but I'm going to read it anyway to make sure you have anything else you want to add to it. What do you think the overall benefit will be by testing so many people? And will this help slow the spread of the virus, since knowing what you have the virus is part of the process?
Dr. Griggs, if there's anything there you need to follow up with.
Yeah, I think maybe there's a bit of a thought experiment around why this testing is so valuable. And if you were to imagine 1,000 isolated people on an island and only one of them has COVID-19, and we don't know who that person is, but let's say we could just do one test a day because of limited testing resources. First, it'd take a long time to identify somebody positive. And while we're just doing one test a day, that virus is spreading in the community. Once we do discover that individual that our first positive, we're way behind the 8 ball in terms of our investigation, identification, contact tracing. In that same population, if you were to imagine, instead of doing one test per day, 50 or 100 tests among those 1,000 population, we'd really quickly identify a positive and be able to contact trace that network of exposures and limit the spread of the virus. In fact, very quickly we would be able to suppress and shut down the virus entirely. So the numbers of tests that we're doing in a community have a huge impact on our ability to discover all of the existing virus and restrict the spread, which is why we're wanting so desperately to capitalize on this moment in time when we have a massive number of free tests for our entire community, so we can identify as much of the virus as possible and really stop it in its tracks. Of course, identification is just one part of the equation. Again, to reinforce my point, if folks don't fully follow the public health instructions, then the information doesn't have value. The discovery of the virus doesn't have value if individuals don't isolate and quarantine. So we've all got to do this together.
Okay, the CDC warned this past week that COVID-19 can spread through airborne transmissions, meaning people who are farther than 6 feet from an infected individual may contract the virus. How does this change the way the health district identifies close contacts or people who have been potentially exposed? And how does this update change public health guidance?
Dr. Griggs, can you talk about your understanding of what the health district will change, if anything, here?
Yeah, absolutely. So the CDC's added information about respiratory spread is not new from the standpoint of large droplet spread, but the CDC information now reflects what literature's been telling us for a few months, which is that the virus can spread in these particles, microdroplets, that as soon as they are exhaled, they dry, and then they can linger or float in the air for an enduring period of minutes or even hours. So individuals who are infected, cough, sneeze, clear their throat, talk, sing, etc., expel the virus in the air, and then it lingers. Now, this isn't the most common means of transmitting the virus. Most commonly, it is large droplets. Those large droplets that you can see if the sun, hits the respiratory droplets just so, you can kind of see them spread. Those large droplets usually don't travel more than 6 feet, which is why we've said 6 feet distance, physical distancing from the very beginning. They quickly fall to the ground. But the micro droplets, you might have heard us talk about aerosolized particles, that's what we're talking about, are the ones that can linger. And this is why it's so important that we capitalize on every opportunity to get outdoors. If we're in a space like a restaurant, retail, so much better for those places to have open windows and circulating air. While we're strongly, recommending that folks are not bringing groups into their home, if for whatever reason you do have anyone who's a non-household member in your home, open the windows, turn on fans, try to get that air circulating. And remember that even if you're following the 6 feet rule, if you've got lots of people in an enclosed space, that there can be enough virus in that environment that the virus can spread. Now, saying all of that, the CDC has not changed its guidance on what a close contact is. So the definition remains the same on close contacts. And our health district will continue to follow CDC definitions and the Texas Department of State Health Services definitions, and not change its definition of close contact until instructed to do so, or until the guidance suggests that they should.
Okay, now that we know that COVID-19 is airborne, what extra precautions can people take to protect themselves, especially indoors?
Dr. Becker, would you speak to that, please?
Yes, sir. I think Dr. Griggs just mentioned a number of things that people can do in an effort to try to prevent spread of airborne disease. And some certainly deserve repeating. So larger spaces are better than smaller spaces. Limiting the number of people in an enclosed space, smart. Keeping a mask on even if you're in a room makes a whole lot of sense. whether you're 6 feet or more from other contacts in that room. So I think all those are very smart. So open a window, turn on a fan. Moving air helps to prevent that stagnant air that holds those particles. So I think those are really smart. If I look at efforts across our facility and others, I'm sure we have air scrubbers in place that pull air out of a space and filter that through HEPA filters. And we typically have those across our organization in areas where we have patients who will, while socially distancing, tend to congregate in an enclosed space. So I think that's an important component that most facilities have put in place in an effort to try to clean and scrub that air in those environments. I think doing your best to wear a mask and keep that mask on at all times remains still one of the primary things that we can do in an effort to prevent spread.
Okay, with the surge testing, will there also be surge in contact tracing? And how is the health district conducting contact tracing now?
Dr. Lawson, can you speak to that?
I'm going to defer that if that's okay. I think somebody else might have a better answer.
Dr. Griggs may be able to answer that a little bit better. I think you've already spoken to it a little bit.
Yeah, yes, sir. The health district has ramped up in terms of its training and its staff to do contact investigations. There is a capacity locally, a threshold beyond which we will have to use the state system, and the state has a vendor who is doing contact tracing once local health districts have exceeded their own capacity to do that work. And so that is the plan right now. So I think that I have heard that there are some scams out there. If the health district will never ask for bank information, if there's ever a doubt of whether it's the health district calling or not, you can call the health district number. You can tell the individual, I'm gonna call our local health district and confirm. And then if it is indeed the health district, they'll lead you through the right steps. If you get suspicion that someone's asking for information that you think they shouldn't be asking, I would suggest just calling our local health district.
Okay, I'm going to let this be the last question. I have a severely compromised immune system, and I frequently visit medical facilities where I have to ride an elevator. How safe are elevators since they're confined spaces? And is there or should there be a new limit to the number of passengers allowed to ride on an elevator together?
Dr. Griggs, can you speak to that, please?
Yeah, of course. So for the individual posing the question, I think the first thought would be, can that person safely use the stairs? The stairwell is going to be a safer environment than an elevator. So if you have the option, use stairs. Just keep in mind that if your hands are on the handrail, you need to use hand sanitizer, wash your hands after using the stairs. For individuals who need to use the elevator, if you're immunocompromised, I'd recommend waiting until that elevator is empty and trying to use an empty elevator and stepping out if somebody else steps on as you progress up the floors. I would, if it's a busy facility and you're afraid that you might not be able to catch an empty elevator, I'd recommend contacting the facility and asking how to manage riding the elevator. I want to read something. This is in Governor Abbott's Open Texas Guidelines. He highlights, this is a quote, "As appropriate, individuals subject to the Americans with Disabilities Act may ride the elevator alone or accompanied by the individual's caregiver." So if you meet that criteria, then contact the facility and ask how. And you can even reference the Americans with Disabilities Act. Other content from those same guidelines are useful in thinking about who might consider using the elevator. The open guidelines say, also, this is another quote here, limit the use of standard size elevators to 4 individuals at a time, each located at a different corner of the elevator to avoid close contact. Masks should be worn in elevators. Utilize touch point cleaning and nanoseptic button covers. I don't know what that is. Nanoseptic button covers, if appropriate. For individuals not wishing to ride an elevator, ensure stairways are available for use. Now, with the information that has evolved since the Open Texas guidelines were published about aerosolization of these particles, I would just reinforce that for anyone who can, use stairwells. When possible, avoid the elevator use with other people who are in the elevators. And remember that any small risk, any one small risk, whatever it might be, has a limited impact, a very small potential impact, but accumulated risk over months and months of community spread really do pose real risk. So it's not in any one small, well, I guess I'll ride the elevator with that other individual. It's an accumulation of all of our health behaviors and all the little risks that we might take in a given moment that accumulate that pose significant risk to the community.
Okay, let's go to our media call. We right now have 2 different representatives from the media. We have Brooke Crum from the Waco Tribune Herald, and we have Drake Lawson from KWTX News 10. And each one will get a chance to ask 2 questions, one at a time. And first, let's visit with Brooke Crum from the Waco Tribune Herald. Brooke, are you on the line?
Yes, I am. Hello.
Go ahead.
So, we've had a pretty steady rate of hospitalizations, like Judge Felton was talking about earlier. How are our frontline healthcare workers doing? Are they getting the rest they need? They have the supplies they need, everything they need to treat patients?
Dr. Eliason, why don't you start with that, and then also like to hear from Dr. Becker.
Yeah, you bet. So far, as far as staffing is concerned, we have appropriate quantities of staff. At times we are stretched. Some nurses are taking extra shifts, and that's a voluntary move. I think some people are tired, but I think people are also at times energized as we see some successes. But being honest, this is an exhausting disease, not just for healthcare workers, but for our nation and our world. This is trying. And it is very discouraging to see even young people, and by young, I'm talking not elderly, who are succumbing to this disease and dying. But as far as your question, are hospitals, do they have the equipment they need? Yes, we have the equipment we need. Do we have the staff we need? Yes, we do. People are tired, but like with anything that is tiring, giving people praise and giving people appreciation and thanking them is incredibly energizing. And we have seen some wonderful outpouring from the community, whether these are thank you notes, whether these are treats, or just even at times we've even had parades where organizations will drive through the parking lot and honk their horns and flash their lights and wave balloons. But just any kind of, I think, measure of appreciation is greatly helpful. And I think if you see a healthcare worker, even if they're not taking care of a COVID patient, thank them and let them know that they're appreciated.
Dr. Becker, anything to add?
No, I think Dr. Lawson did a great job there. So I would say as well, we have all the equipment that we need. We have adequate ventilators. We have adequate beds. We have the medications that we need. Our staff is growing weary, as we see across the whole community, which Dr. Lawson also pointed out. This is fatiguing for everyone who is having to deal with coronavirus. And no one is not having to deal with coronavirus at this point in time. So I think from our first responders through our emergency room and our front door and all the way through the hospital, it impacts everyone, whether it's the person who is cleaning a room, the person who is delivering a food tray, whether it's a nurse at the bedside. Everyone has to take extra precautions in trying to deal with and prevent the spread of coronavirus. So I think we think of physicians, we think of nurses, but it is every employee across the organization who is impacted by this, and then it extends outside of our walls. Like Dr. Lawson, I want to say thank you to our community who has been hugely supportive of folks in our facility, and thank you.
Okay. All right. Let's see. Drake Lawson from KWTX News 10. Drake, are you on the line?
Yeah, Larry, can you hear me okay?
We do. Go ahead.
Can.
Okay, perfect. Wanted to just ask, touch base with Judge Felton again. You mentioned it off the top about the 15%. I know last week when we had this presser, you said you were going to apply for a waiver. We're looking at, possibly them not having to, y'all enforce it. Are you enforcing it? Has there been a waiver? And are you enforcing it on businesses that aren't dropping down to 50%?
Well, as I've said in the past, that we have chose the route of actually more education and discussions with these folks. But, we're not getting a lot of complaints right now. And but we are under the rollback of the lesser percentage right now. And, there's definitely some people that have expressed unhappiness with the situation. But, I hope that I'm in great hopes that this testing effort that we're going through will help us identify and get our arms around some hot spots and get these numbers down. But, I'm also encouraged that we were only up above 15 one day, which was Saturday, and that hopefully we can be able to go a few more days and roll that back. But, we're still, if we get complaints, we follow up on it. We try to educate. We're not trying to be heavy-handed. We really see a lot of cooperation, especially with businesses. They want to make their patrons feel safe when they come into their place of business. So that's kind of what we're doing.
Okay, let's go back to Brooke Crum from Waco Trib. Brooke, do you have another question?
I do not. Thank you.
Okay, thank you for joining us. Drake, do you have another question?
No, I'm good, Larry. Thank you guys so much.
Thank you all both for joining us. Well, let's go to the wrap-up part of it, which we'll go to Dr. Brian Becker first, and followed by Mark Lawson, Jackson Griggs, and then Judge Felton and Mayor Dever. So let's start off with final comments from Dr. Brian Becker from Ascension Providence.
Larry, thank you. Thanks to everyone on the panel, and thanks for the invite, as I said earlier, to participate in this. I think it's vitally important that we get information out to our community, and this is a very good tool to do so. I want to encourage folks to participate in the free community testing that's been mentioned on this program. I want to advise people to get their flu shot, critically important this year. I want to continue to encourage our community to practice social distancing, use of masks, hand hygiene, and then stay home if you don't feel well. It may or may not be something of significance, but we don't want to spread coronavirus or flu. So if you're not feeling well, stay home. And then lastly, I encourage people, we've seen this is not something that we're going to see disappear very quickly. And those folks with chronic conditions may have opted not to see a physician, not to manage that for some time now. And I would encourage them to continue to see their primary care physician for care of chronic conditions on a regular basis and to take their medications if they're indicated. So thank you very much.
Thank you. Dr. Mark Lawson from Baylor Scott and White.
Following excellent comments there. So I would second everything that he has said. Additionally, I guess maybe just a couple of comments. One of the questions I routinely ask my patients who are in the hospital with COVID-19 is there anyone else in your home who's sick? Or do you know anyone who has been sick? Or do you have any clue how you got this? And I'm often amazed at how many patients will tell me, look, I've been really careful. I don't go out very much. When I go out, I wear my mask. I have no idea how I got it. That's alarming to me and to them because there was some lapse, right, in their caution, whether they were exposed to somebody at home or outside their home, something happened. And so people, despite they thinking they're careful, they're not as careful as they needed to be or should have been. So again, I want to just really emphasize the importance of social distancing, not having people in your home who are not close contacts, regular contacts, part of your immediate household. And this is fatiguing because it does require sacrifices on our part as a community, as a family, as a person, to not be able to do certain things. But this is a serious disease, and all it takes is talking to somebody who's had it. And I'm not talking about one of the mild cases. I mean, we're seeing people severely injured, severely debilitated, and sometimes dying from this disease. So again, just be very cautious. And by cautious, we're talking about wearing your mask when you're out in public. I had a conversation with my parents not long ago, and they were a bit kind of proud of themselves because when they were going to the store, they were wearing gloves and they were wearing their mask. And so I stopped for a moment. I said, okay, well, tell me what your routine is. When are you putting the gloves on and when are you taking them off? And they were saying, well, we get in the car and we put our gloves on and we drive to the store and then we get out and we go to the store, we come back to the car, we take our gloves off. I'm like, okay, well, pause for a moment. You just contaminated the inside of your car. So your gloves were in the store, you touched various items, you come back to the car, you touched your steering wheel, you touched the side of your door, et cetera, et cetera. So again, just being very methodical, not wearing the gloves in the car would be kind of that safe zone. So again, just kind of think through the process of how you could be exposed and try to circumvent that and prevent it. Additionally, as I said, this is fatiguing for healthcare workers because it's emotionally draining. And we do care about our community. We do care about our patients. And it pains us to see people sick, people suffering, and losing people. It's also fatiguing for our community that we've had to cut back on social events and commercial events and various activities and social events. But it's incredibly important that we continue onward and to congratulate people and to let them know that they're appreciated. Final push for flu shots and for social distancing. Thank you.
Thank you. Dr. Jackson Griggs from the Family Health Center. Dr. Griggs.
And like Dr. Lawson, I just want to echo the strong and very smart comments from these excellent physician colleagues. It's an honor to be with both of you guys in this press conference because I've had admiration for both of you for years and years. So this is fun. After having been tested this morning at the surge site, I want to give a very strong applause to Ryan Durker, to Stephanie Alvey, to Elizabeth Thomas, and all of those at the Health District and EOC who have worked so hard to get this surge testing up and operational in such a short window of time. Similarly, I want to just really praise Bradley Ford and Deidre Emerson and Ryan Holt in the city manager's office. Wow, just outstanding leadership in our community. Thank you, thank you. And of course, our mayor and city council and our judge and the commissioner's court. And thank you both for your leadership. Seeing this get operationalized and so well done in the brief time that we've had to set it up has just been really impressive, and it makes me excited about what our community is capable of doing when we have the resources. So praise and thanks to all of those who have their fingerprints on this work.
Okay, McLennan County Judge Scott Felton. Judge?
Well, thanks, and I appreciate all that's said regarding the advice the medical folks have given, as plus the accolades given to all those that deserve it too. And I wholeheartedly agree to that. I'm looking really forward to the next couple of weeks as we learn things from this large amount of testing that we'll be doing and how we can strategically take that knowledge and utilize it to the benefit of our community. And so I think this is an exciting time, and we have the right players in this community to make things happen. Also, talking about psychologically how this affects people, and I know people that it has affected, and I mean, you can't say that it hadn't affected almost anybody, yourself included. But there's a lot of opportunity to seek counseling in various different capacities, with your church or MHMR or your friends or your general practitioner. And also, that brings to a point that there's no one in this community that does not have access to medical assistance and care. And, the county is responsible for the indigent health side of the program. And we work very close with all the hospitals and medical community, especially with the family health, and try to get people that aren't, that due to various reasons have never had a general practitioner, or really maybe does not understand the value of that. So, folks that are out there that know someone or that person, there's a way to get help no matter who you are. I'm excited to hear that the convalescent plasma is such a good thing, because we do have a lot of people that have recovered from coronavirus. And so, I'm thinking about ways to reach out to many of those and say, it's an opportunity to help and give back to the community. So y'all have any thoughts on that later on? Well, let's talk about it. And thank you very much, and appreciate the people that listen in and watch, and appreciate any questions anyone would have during these press conferences as well. Thank you.
Thank you, Judge. Welcome, Mayor Kyle Dever. Mayor?
Thank you, Larry. I want to thank the doctors who've joined us again here today, Dr. Griggs, Dr. Becker, and Dr. Lawson. You all bring such great content to these press conferences, and you are the people that our citizens most want to hear from. You're trusted, and people still have a lot of questions about how they should handle this, especially if they get sick. So thank you for being here. Thanks to Judge Felton again for your great leadership at the county. And thanks to the city and health district staff that help us put this press conference together each week. Larry Holsey, your staff, Kelly and the staff at the health district, and Julie and the staff of the city secretary's office. And I want to mention that today is Julie's birthday. So happy birthday, Julie, and thank you for being here today on your birthday to help us with this. Most of all, I want to thank all of you who are watching this and doing your very best every day to do the things that you know will help us slow the spread of the virus. You are making a difference in our community. The testing that we are now doing would not be possible without the aid of Governor Abbott and United States Ambassador Dr. Deborah Birx, and I really want to express all our appreciation to them for making this testing possible. I also want to thank the Texas Department of Emergency Management and the Texas Department of State Health Services and the Texas military who are here to help staff this testing. We've got so many people that need to be thanked for this. It's sort of limitless, and I appreciate people calling out the names of the folks at the Emergency Operations Center in the city. I also want to thank Judge Felton and his team at the Health District, as well as the health at the county, as well as the Health District. And finally, I want to mention that we will have bilingual personnel at each of these testing sites the entire time that we're doing this testing. So that's really important. One of the main focuses that we wanted to bring to this was to focus on the Hispanic community that has been hit harder than any other community within McLennan County by the COVID disease. They have had worse outcomes and, followed closely behind by the African American community. But we want to be sure that the Hispanic community, the Latino community, is comfortable at the testing, and so we have bilingual personnel there to help them get tested. Dr. Lawson mentioned the need to give blood. We discussed this last week. There is a critical blood shortage in our region. I gave blood last Thursday, and it reminded me that I don't do that nearly enough. That is something that we can all do, that we can help each other with, and especially if you have had the COVID disease, give that plasma, and that can be really helpful. Go to carterbloodcare.org to make an appointment. We talked a couple of weeks ago about the upcoming holidays. I want to mention that again now. Halloween, Dia de los Muertos, and Thanksgiving are all on the horizon. I mentioned this because I know that a lot of people are beginning to plan for these events, and they are all opportunities for significant spread of the disease, but there are things that can be done to make those activities much safer. And the CDC has released excellent guidance that can help you in planning. Simply Google CDC holiday or CDC Halloween or Thanksgiving, and you will see that guidance. It could make a real difference in our community, and it can make a real difference in your family. I ask that you continue to keep those who have died from COVID-19 in our community and their families in your prayers. Also, please continue to pray for our frontline caregivers, as well as our first responders and their families. All of these people are putting themselves at risk to help to keep us safe, and we just can't thank them enough. As always, take care of yourself and take care of each other. This week, that means in addition to doing your part by wearing a mask and keeping your distance from each other and washing your hands, we're asking that you get a flu shot and get tested. Those are things that can make a real difference in our fight. We are getting through this together. Take care.
Well, thank you all, as always. Valuable, valuable information. I do want to remind our viewers and listeners that we are having a full Spanish translation viewing of this press conference this afternoon at 4:30, as well as an English replay of it at 7 o'clock on our cable channel this afternoon. Always available on video on demand as well, so you can just go to the covidwaco.site and you'll be able to replay it there too. So we're through today. We're going to be back next week, same time, whatever, but here's what I want you to do. Go out and get tested. It's free. We hope you have the rest of a good afternoon. Thank you for joining us.